Hello, everyone. This is Dr. Andrew Campbell, and this webinar is going to be is titled From Contamination to Cure, Mycotoxin Treatment Insights. And this is based on medical facts and science, medical evidence. This is not from Dr. Google or from websites from so-called experts who are basically looking to make more money and increase their profits. So having said that, this is just a disclaimer, and the information provided here, like all of my presentation, is to educate. I don't profit on any of this and do not promote anything. Here's what I do. I'm the editor-in-chief of 3 medical journals. I'm on the co-editor of a 4th, etc. And I review, as you can see, I review a lot of studies. And I get my information based on facts, medical facts. A key to solving medical problems caused by toxins and by many other things is number 1, detect the cause, number 2, remove the cause, and number 3, repair the damage. So with climate change, molds and mycotoxins, we now see climate change with floods everywhere, all over the planet. There's a week that goes by that somewhere there isn't some major storm or disaster, etc. A lot of hurricanes, rising waters, etc. Mold infested homes, schools, businesses, and public buildings. And this is according to indoor air pollution by the World Health Organization. And so this is one of the reasons that there's more mold issues now than there's been before. So here's new construction. Look at the mold growing. And here's mold on the existing structure behind walls when you remove it. And here's this one was where a refrigerator was. Here's underneath wallpaper. So here's looking down in a inside a wall. You see all the mold growth, and you can see mold growth here as well. And this was in a closet in another part of the home that was in a guest room that wasn't used very much. So a lot of people talk about, what about indoor? How do you do indoor analysis, etc.? I'm not an expert in house mold and how mold, what you should do about your house and how to test for it and how to remediate it. I rely on an expert for that, just like I'm an expert in health of people, human beings. He is an expert in that. His name is Brantley May. I did a webinar with him last month. It's on MyMycoLab YouTube channel, and you can see it's the one that has 2 faces. And he goes through all the different parts, the pros, the cons, etc. And independently, he also has on YouTube shows like, what do you do about clothes, mold spores in clothes and things. But this was a study published last year, and you have to use swab air samples on different media and look at it microscopically, etc., than the usual quick whatever, and charge you a lot of money. Why am I showing? And by the way, this is from a very well accepted journal, Mycotoxin Research. Here is a study that was done on the heating, ventilation, air conditioning, duct, refrigerator compressor, and the air filter. This shows you what was growing in all of it. Now, if you look at the first column, it says aflatoxin, it's all 0. Aflatoxin you don't find indoors, so why test for aflatoxin in your body? You don't need it. Ochratoxin, trichothecenes like satrotoxin, gliotoxin, etc., Yes, those are the highest. So these are medical and scientific facts about mycotoxins. And what I want you to pay attention to is look at the bottom. These were published 35 years ago or longer. Okay. So the spores of these toxic molds contain mycotoxins. And mycotoxins associated with these spores are likely to be absorbed through the respiratory epithelium in your lungs and in your nasal passages, then transported to other sites. And it produces systemic effects, meaning throughout your body. It's not the gut. Oh my gosh, these people are, the misinformation on the internet is incredible. So, mycotoxins, so you see that it's going to be systemic effects, which means everywhere in your body. Now, this is important. Size matters. Why? Because again, it's through inhalation or through your skin that you get it. Hair is 100 microns thick. Mold spores are 1 to 20 microns, usually 3 to 4. And mycotoxins are 0.1 microns. That means they're the same size as a COVID virus. By the way, when COVID was going around and that we had this huge pandemic, did they ever test COVID with urine tests? No. So why would you test mycotoxins by urine? Look at the size. Okay, so brain. Where do mycotoxins first affect the body? It's the brain, okay? And this is overwhelming medical and scientific evidence that shows it's the brain and nervous tissues that are affected first. And mycotoxin antibodies bind to this tissue, including neural tissue such as myelin, triggering demyelination, loss of myelin, which is the main cause of diseases such as MS, multiple sclerosis, other diseases such as chronic inflammatory demyelinating polyneuropathy, Guillain-Barré syndrome, etc., all triggered by mycotoxins. And here are the neurological effects of these mycotoxins, all the way from autism spectrum disorder, decreased short and long-term memory in adults and children, optic neuritis. I mentioned already just a moment ago, chronic inflammatory demyelinating polyneuropathy, also known as CIDP. Loss of balance, facial pain, ALS, which is amyotrophic lateral sclerosis, Lou Gehrig's disease, Alzheimer's disease, and multiple sclerosis and Parkinson's. Latest studies show that for ALS, Lou Gehrig's disease, 5 to 10% are genetic. The rest are all caused by mycotoxins. Alzheimer's, it's estimated at 35% is caused by mycotoxins, and multiple sclerosis over 60%. Parkinson's disease is about 50%. So it's up. These are from studies. Let me show you. This is from a study that was published 8 years ago. And it says different brain regions, including the external frontal cortex, cerebral hemisphere, all these different areas of the brain contain fungal material. Analysis of brain section from 10 additional patients, Alzheimer patients, reveals that all were infected with fungi. It was also in the blood vessels. Okay, so now let's go to this study. And this is with Lou Gehrig's disease, amyotrophic lateral sclerosis. And they concluded our observations provide compelling evidence of fungal infection in the ALS patients analyzed. And they analyzed the cerebral spinal fluid and the brain, all positive. This is also an 8-year-old study. Then This is a study that was published 3 years ago by Dr. Tuminen, a good friend, a wonderful, wonderful doctor. She's a wonderful lady. And she said that POTS, postural tachycardia syndrome, myalgic encephalitis, chronic fatigue syndrome, autoimmune disorders, and dysautonomia are linked to mycotoxins. And she showed it how in this study that is below. So, in this study, this is a study from, these are various studies from Tufts University School of Medicine up in Boston, showed that 172 children with autism and 61 controls who didn't have autism, there's a significant difference in comparing the antibodies to mycotoxins, not the urine, serum antibodies to mycotoxins between the two groups, with the autism group showing elevated serum antibodies to mycotoxins. So here's another study. Mycotoxins trigger the onset of or exacerbation of chronic inflammatory diseases, as well as autoimmune disorders like lupus, rheumatoid arthritis, psoriasis, autoimmune thyroiditis, all those. And mycotoxins affect testosterone because they upregulate aromatase, the enzyme responsible for the last steps of estrogen biosynthesis from androgens, in other words, testosterone. So you and I have seen young men with very low levels of testosterone. And unless you can treat it with all the injectable or gels or patches that you want of testosterone, it's not going to go away until you treat the cause, and the cause is mycotoxins. So estrogens are also affected by mycotoxins, okay? They bind to estrogen receptors and they confuse the pituitary gland as to how much is the actual amount of estrogen in your body, okay? And to have the right amount of estrogen is absolutely necessary for proper brain function, gut function, and blood sugar regulation. Well, mycotoxins affect that in women. So the mycotoxins also affect thyroid. And what is the effect? The effect is they cause Hashimoto's thyroiditis, which is basically an autoimmune thyroiditis. And here's breast implants. The implant on the left is what it should look like. The one on the right is the one that's moldy. So 30 years ago, starting 30 years ago, I published with a group of other doctors 23 different studies on breast implants. Both silicone and saline have these molds in them. Here's SIBO. Here's a young woman, pre-itraconazole treatment, June 10, 3 months later, 3 months later, you see what's happened. Normal, okay? Let's look at psoriatic arthritis as a autoimmune disorder, rheumatological condition, okay? So you can see the skin on his arm, abdomen, and chest, but look at the ring finger, and you can see the arthritis, the rheumatoid arthritis. So let's look 6 months after you treat for mycotoxins. He's happy as a lark. Here's, this is actually the mother of a doctor, and he asked if I could help her. So she went, saw her regular doctor, and was given creams, et cetera, et cetera. She had mold in her home. Here is the before and after picture. treatment for the mycotoxins. Obviously, it worked. She took this picture herself on her cell phone. Okay. So how do you test for this? What are accurate and precise tests? What are inaccurate and unvalidated tests? And what are tests that have no medical basis or fact whatsoever? Total sham. Most accurate and precise tests for mycotoxins is from MyMycoLab. It's serum antibody testing for IgG, which demonstrates a toxic reaction to the mycotoxins, and IgE, which indicates mast cell activation and can result in mast cell activation syndrome. And it's for 12 different mycotoxins. And here are all the different, each individual mycotoxins. The urine test doesn't do this at all. They test for metabolites. Metabolites of mycotoxins are like when, if you and I were to eat asparagus, for the rest of that day, our urine would smell of asparagus. That's the metabolite of asparagus. That's what they're testing. They don't test the actual mycotoxins. So let me explain to you antibodies so that everybody is clear, because a lot of people are unclear about this. There are 4 categories of pathogens. Pathogens are microbes that cause problems: bacteria, viruses, pathogenic fungi, and parasites, okay? We develop antibodies to these after we've been exposed or we've had an infection. So when I was a kid, I had chickenpox. Today, I have antibodies to the chickenpox virus. These are living things, living organisms. They have cell walls, etc. Again, the antibodies disease means sometime in the past. Toxins are not alive. They're different. They do not have cell walls. Mercury does not have cell wall. Mercury is not alive. It's a molecule. Mycotoxins are molecules. They're not alive. So antibodies to toxins indicate current immune reaction, not past. Okay? And so once the toxins are gone from the body, the antibody reaction fades away. And here's an example. This on the right and left are normal patients. We all the time check in the lab, in MyMycoLab, we get serum from healthy donors. This is what serum from healthy donors look like. Okay, and what does it look like when it's not? And here's a patient testimonial. On the left is before treatment, and on the right is after treatment. Feeling great. Thank you for the gift of health, as the patient wrote. Unhelpful test, NeuroQuant. This is a test for brain atrophy, meaning Alzheimer's, or if you had brain trauma. SPECT scanning, single photon emission computerized tomography, is a much more useful test in clinical medicine. The doctor that kind of helped bring this about in medicine, in neurology, in psychiatry, etc., was Dr. Daniel Amen. We've known each other since before either one of us had a gray hair. He's a wonderful person, brilliant doctor. He is the one who started promoting SPECT scans. And believe me, folks, I've done many SPECT scans on my patients. It shows you in 3D, 3-dimension, your brain. Marcons, forget it. There's no evidence in medicine that there is such a diagnosis or treatment. There's one lab that does this, but it's not recognized in medicine. It's total sham test, sham diagnosis. So here are the tests that lack medical evidence: the urine testing for mycotoxins, the OAT test in urine for molds, the genetic test, the HLA-DR, the visual contrast sensitivity, doing an MSH, a C3A, C4A. Let me tell you, as a clinical immunologist, C3A and C4A only denote inflammation. It could come from anything. It's not indicative of mold or mycotoxins. It can come from anything. Let's look into this a little more. This is a 2022 study from October, as you can see, exactly a year ago. We're in October right now of 2023. This was 2022. The variability of mycotoxin concentration in urine and its volume based on daily intake demands urine sampling at different times during the day. And because it's very challenging because of various factors, such as gender, age, diet, muscle mass, all of these can influence creatinine secretion. What did this published study also show? That the ELISA method to detect mycotoxins in human serum comes with significant accuracy, precision, and specificity. That's the test that MyMycoLab does. It's the ELISA method. So you're getting significant accuracy, precision, and specificity. And a one-time shot in urine doesn't mean anything. The organic acid test, OAT test, okay, is used in neonatology when babies are born for rare inborn genetic defects of metabolism. This is in newborns. It's a useless test for molds. Don't get fooled. The HLA-DR, there's people out there on the internet that says 25% of the population and it's going to do this. Well, 25% of the population is 82 million Americans. There's no published studies relating this gene, the HLA-DR, to anything with molds and mycotoxins. There's no research. It's not taught in any medical institution. It's no basis in medical science. 82 million. Let me tell you, have you ever heard of diabetes? That's 32 million. 50 million less. This one, which is 50 million more people, is unknown in medicine. So don't be fooled by the internet and Dr. Google. And here is the urinalysis. It's easier to do, but it reflects day-to-day variations. And you have to do it several times during a same day over a 24-hour period. Okay, and it typically indicates mycotoxins from intake from food or drink. Okay, so how do you treat this? You apply the first rule of toxicology. Get the patient away from the toxin or the toxin away from the patient. A person's health cannot be restored if they continue to be exposed, no matter what the treatment. That exposure can also come if you move and your new place has mold, or you brought with you moldy things. So both apply. Also, don't eat ultra-processed foods. This is the list of ultra-processed foods. Make sure that if I come visit you and open your pantry or your refrigerator, you don't have any of these things in there. These are not good for you. You've got to have a good, healthy diet. And I did a webinar on that just recently on what to avoid and what to make sure you eat. And you can access all my webinars by going to the YouTube channel for MyMycoLab. Okay, now, what supplements help improve cellular function? Well, there's vitamin D, there's CoQ10, there's B complex, omega-3 fatty acids, magnesium, turmeric, and spore-forming bacilli probiotics. Let's go through these. Now, I want to caution you, 11% of nearly 60 tested dietary supplements actually contain an accurate amount of key ingredients listed on the label. This is from a recent study. 40% of these 60 supplements did not contain a detectable amount of ingredients at all. 40%. This is why I am so picky about where I recommend my patients get their supplements. because there's a lot of companies out there. And it's very important that you do get these supplements. Why? Here's vitamin D. It's helpful in cognitive impairment, vascular dementia, Lewy body dementia, and other conditions that develop due to brain cell malfunction or cell death due to mycotoxins. And low levels of vitamin D, and I check every patient for vitamin D levels, these are associated with increased cognitive impairments, diabetes, cardiovascular issues, cancer, and respiratory diseases. I take vitamin D3 every day, 5,000 international units from Clear Labs. Omega Q Plus Max. This was developed by a good friend of mine, knew him for many decades, and he unfortunately passed away. Dr. Steve Sinatra, cardiologist in Connecticut. And he formulated this product, Omega Q Plus Max. It has DHA and EPA from squid. So it doesn't come from fish, which can contain mercury. It has L-carnitine, curcumin, coenzyme Q10, and resveratrol, which is a great anti-inflammatory, as is curcumin. Melatonin. And you don't need these huge amounts that I see advertised, 30 milligrams, 50 milligrams, 20 milligrams. That's ridiculous. 3 milligrams is enough. The benefits are it reduces cellular damage from toxic agents in the brain. Okay? And melatonin's ability to protect neurons from molecular damage due to a wide variety of substances, including mycotoxins. What about magnesium? I published an article about 10 years ago or more on magnesium. This is a master mineral. We used to get it from well water. You remember, for thousands and thousands of generations and millenniums, we got water from wells. Well, down in the earth, there's all kinds of minerals, magnesium, zinc, etc. Now we get it out of a plastic bottle. So no wonder we're deficient. It's a necessary ingredient in approximately 350 enzyme systems in the body. Up to 80% of the population are deficient in magnesium. And magnesium binding sites have been detected on 3,700 plus human proteins that are essential for building, repairing, and maintaining your body's cells. So the maintenance of the body is via magnesium. So B complex. These are 8 water-soluble vitamins. Okay. So they affect the brain. B vitamin should be brain vitamin. It includes energy production, DNA and RNA synthesis, as well as repair, genomic and non-genomic methylation, and the synthesis of a bunch of different neurochemicals and signaling molecules. Furthermore, in human research, it shows that a significant proportion of the human population of developed countries, now these are developed countries, these are not third world, suffer from deficiencies or insufficiencies in one or more of this group of vitamins. So it is essential for preserving brain health. That's why I always recommend it to my patients and take it myself. Now, phosphatidylserine, and then I get these people who treat patients and ask me, why not choline? You mean to tell me you don't look these things up? You just watch somebody talk about it on the internet and don't actually read up on it from published studies? I don't understand that. The effectiveness of phosphatidylserine has been studied in double-blind, placebo-controlled, randomized clinical trials. It enriches myelin, and if you remember, we talked how myelin is affected by mycotoxins. It influences the metabolism of neurotransmitters like acetylcholine, norepinephrine, serotonin, dopamine. Serotonin is our happy neurotransmitter. It stimulates and enhances performance on tasks that test learning ability and short-term memory. And compared with placebo, phosphatidylserine supplementation produced significant improvements in short-term recall, immediate memory, vocabulary skills, and the ability to recall words, attention, and vigilance. Why wouldn't we give this to our patients? And then, oh, well, what about choline? Oh, gosh. Okay, well, go read, not watch. Nitric oxide, N101. What does it do actually? Yes, it helps improve several neuroendocrine and behavioral abnormalities, but what it does in the brain is it dilates your blood vessels, so more nutrients and oxygen get to all the different cells and all over the brain. That's why we have over 400 miles of blood vessels in our brain. Yes, they're mostly capillaries, but they're still 400 plus miles. Probiotics. Reading University in London, Dr. Simon Cutting did this, published these studies, okay? And they showed that less than 10% of the usual commercial strains of lactobacilli and bifidobacterium in probiotics are able to get to the colon. So you need to use spore-forming bacilli. I use megaspore biotic. Itraconazole, also known as Sporanox, is a common antifungal agent. It was developed in the 1980s. This was published 6 years ago. It's been in clinical use for 35 years, now 41, with an established safety record. Then people go to Dr. Google and say, oh my God, if I take this, my teeth are going to fall out, my hair is going to fall out, and I'm going to die, my liver is going to be destroyed, and all this stuff. Read the medical published studies. Here's another one. Itraconazole is a broad spectrum triazole antifungal agent. It has favorable pharmacodynamic and pharmacokinetic profiles. It's available both orally and intravenously. It's a valuable antifungal drug, has been well tolerated with doses of up to 400 milligrams per day, being generally free of serious side effects. Let me show you one more. This is voriconazole, the cousin. Are not altered in critically ill patients with acute on chronic liver failure and continuous renal replacement therapy. So these people who are in liver failure and renal replacement therapy are not affected by voriconazole. Okay, there's basically two types of mold: single cell, multiple cells. Single cells are the yeasts, and there's many of them. The most famous is Candida, and its effective treatment is by nystatin, which is kind of weak, and fluconazole, and diflucan is the name brand, okay? Now, fluconazole, though, does not affect multiple cell molds, okay? What are multiple cell molds? Aspergillus, Stachybotrys, Penicillium, Cladosporium, Fusarium. It's not going to touch those. You need itraconazole. But here's the thing, itraconazole will also kill off yeasts as well as the multiple cell. And I have people who see patients out there giving them fluconazole, thinking it's going to help. Unbelievable. And then these patients come see me and I get them well. Okay. Glutathione warning. What? Read the underlined part. These results indicate that glutathione promotes gliotoxin-induced cytotoxicity. It's a published study. It's an older study. It's been around since 2006. Please read the literature. Don't watch some so-called expert telling you what to do or not to do. Ask him for proof. Here's your proof, your evidence, your medical and scientific facts and evidence. Binders, the big myth. This is what studies show. Okay, the binders rely on the absorption of mycotoxins from the gut so that it doesn't get out into the blood. Here's all the different kinds you can read: kaolinite, clays, zeolite, bentonite, activated charcoal, blah, blah, blah. They are effective in neutralizing aflatoxin. Now, do you remember the slide I showed you where when they tested the HVAC systems, etc., there was no aflatoxin? Well, that's the only one binders affect. They are ineffective in all other mycotoxins. On top of that, they also bind vital vitamins, which we have just gone through, as well as macro and micro elements, such as magnesium. So don't be taken in by all these binders. It's BS. By the way, binders also bind these things. Yes, but I take mine 6 hours after I. You think that's really? Show me one study that shows that that happens. There isn't any. So, like all your hormones, estrogen, progesterone, thyroid, your oral diabetic medications, your antibiotics, your diuretic pill, etc., all these are affected and bound by those binders that are so famous. So let's talk a minute here about Borrelia Lyme. You can find Lyme antibodies in 5 to 20% of normal people. Okay? These are people who don't have Lyme, but the antibodies are there. They're not sick, they're fine. And this study, and I'm going to tell you a little more about the study in a minute, both IgG and IgM antibodies can persist for several years after a person had Lyme, even though they had a perfectly clinically healed infection and they're well. And then they're tested by these people who see patients, and these tests are used. These are unsuitable tests for Lyme. Okay? Well, these are the big IGeneX, Vibrant, and all those tests. The best test available is the only patented test in the United States, and that's Immunosciences Laboratory in Los Angeles. Okay. In consequence, a positive finding alone of Lyme does not establish, in the blood, does not establish the presence of an infection. And so many people out there treat this by looking at the lab report and not the patient. And it says here very clearly, blood testing should be ordered only if there is adequate clinical suspicion of an active infection. Okay? Otherwise, the predictive value will be low. Most patients who have Lyme disease respond well to antibiotic drug therapy, and their disease resolves. Now, let me tell you a little bit about the study that looked at a lot of this in just a second. I want to bring this up. 2 clinical trials in Europe of antibiotic drug efficacy established that only 2 out of 244 patients, less than 1%, had failure from the treatment. The other side of that same coin is 99.2% had treatment success. 99.2. They didn't need more than 2 to 3 weeks. And finding from those microbiologic studies are substantiated by 5 clinical trials in the United 'States and Europe that failed to show that PTLDS, post-treatment Lyme disease syndrome with additional. You don't need more treatment. You don't need 6 months and IVs and antibiotics for a year, 2 years, 3 years. It's not going to help. No lasting improvement was found in any trial. No benefit was found with respect to either two endpoints, fatigue and quality of life, by giving them antibiotics beyond 3 weeks. Now, this study was done in Germany, and the way they did this is they reviewed all the Lyme publications that exist in every medical journal. And this was done by all the big Lyme doctors of Germany. And then they asked the head of the different medical societies, the head of the cardiologist, the head of the dermatologists, the head of the internists, the head of the pediatricians, etc., to review this consensus. And when it was accepted by everybody, then they sent it to Austria and asked that all the Austrian doctors that treat Lyme and that the heads of all the different medical organizations review this. And when they came to an agreement, also, meaning both the Germans and the Austrians, then they sent it to the Swiss. The Swiss are known for precision and no nonsense. And the Swiss agreed. So, if you are being treated for long chronic Lyme or whatever you want to call it, it's not that. These studies all showed that after 3 weeks, if the patient is still sick, look for something else. And what is that something else? That something else is very simple. It's mycotoxins. I can't tell you how many patients who have been on antibiotics for years, did not get better, did the mycotoxin antibody test with MyMycoLab. It lit up like a Christmas tree, started treating them. 2 to 3 months later, they're almost well. So here's tools that I would recommend. It's the Immune Dysfunction Questionnaire. I developed this decades ago. It's still very good. It's 2 pages long. It helps guide the clinician in its symptoms. Look at the first one, if you can read it. It's fatigue, memory disturbance, depression, anxiety, mood swings, sleep disturbance, etc. Okay? These are commonly found in patients suffering from molds and mycotoxins. And what the patient does on the left column, the patient scores from 0 to 10, 10 being the worst. And on the right, when did it first start? And this helps the clinician. Here's a common email I get. I've seen over 5 naturopathic doctors. They prescribed herbs, binders, and cholestyramine. These things just made me feel even worse. Do you know anyone that can help me? And this is actually a professional. A doctor wrote me this. Much of the information in these internet courses, today they're called summits. That's the popular word, summit this and summit that. They're not supported in medical science. And this makes it very difficult to get traditional medicine to get behind molds and mycotoxins, as well as to have valid codes so that insurance companies pay for the testing and treatment. Shoemaker is now promoting a test that has no validity in medicine, the VCS test. We mentioned it before, the visual test. Others, such as labs that perform urine tests, do not give results that have anything to do with indoor environmental exposure to molds. Many of these so-called experts have never published anything in peer-reviewed journals, nor lectured in medical universities. I have. I have over 100 publications, and I lecture and continue to lecture at medical universities in the United States and in other countries. These experts, their expertise lies in marketing themselves on the internet, and I'm going to also mention in social media, and all of this is to increase their profits. This doctor who wrote this was correct. Here's another one. On behalf of Dr. So-and-so, we at So-and-so Health want to thank you. This went to MyMycoLab. We want to thank you and Dr. Campbell as we're having amazing clinical results using your testing in conjunction with our gut microbiome program to reverse autoimmune disease. We have a total reversal of Graves' disease of the thyroid and an almost complete reversal of Crohn's, many patients, thanks to the test. Okay, here's a patient. I've been battling mold illness close to 7 years. The entire Ritchie Shoemaker protocol did nothing. I truly believe that the mold I was exposed to colonized my body, and there's been an internal production of mycotoxins ongoing. I've seen your videos and truly believe you might be able to help me. And this patient was helped. I recommended that he see a particular doctor in his area that's been trained by me, and it helped him, and he's now well. So my next webinar, oops, I'm sorry, it's next Wednesday. It's not, it's not May 31st. I'm sorry. It's the 23rd, tea time, and you can ask about anything medical. Heavy metals, Lyme disease, breast implants, molds, mycotoxins, etc. Also, at the bottom is my email address, so you can ask me questions, you can get copies of studies or of the questionnaire and what labs to use. So hope to see you next week at tea time. You get on board and you can ask me anything as long as it's about medicine. And that's it, folks. I wish you all the best. Have a good rest of the week. Take care.